My names remain Matthew Ocheleka Itodu, a lecturer in Federal University of Health Sciences, Otukpo, Benue State, Nigeria. I'm here to take you on the topic clinical compositions and their diagnostic values. So at the end of this course, my student or my listener should be able to explain some biochemistry tests and able to explain biochemistry tests and their diagnostic values using some biomarkers. And so listen attentively as we proceed. Clinical biochemistry focuses on the measurement and analysis of biochemical biomarkers. And this substance that is present in body fluids such as blood, urine, and cerebrospinal fluid or synovial fluid. I want you to understand something carefully, that in clinical biochemistry, there's something we call a sample of blood. For example, if a sample of blood is collected, there are substances that is present in this sample of blood. And the level of those substances need to be checked so that we'll be able to predict or monitor a disease condition. So it is possible to diagnose a disease condition by knowing the amount of the substance that is present in the sample. So we go ahead. This measurement provides valuable information about the functionings of various organs and systems in the body. So in the organs of the body and system of the body, there are so many disease conditions that is related to the amount of the substance that is present in blood. So for us to be able to manage a disease or carry out an accurate diagnosis of a disease, it's very good that we use these biomarkers to check the amount of the level of those substances that is present in blood, urine, and cerebrospinal fluid. This clinical composition of biochemistry samples refer to the specific biochemical markers. You see now that the clinical composition of these biochemistry samples, it refers to the specific biochemical markers, substance molecules that is present in these blood samples. I told you earlier that at the course of these lectures, one of the objectives that I would like all of us to achieve is what? We should be able to list clinical biochemistry tests and their diagnostic value. And I started by explaining a blood sample, that in order for us to be able to monitor a disease or diagnose an accurate disease condition, we should be able to know the amount of the substance that is present in blood. And so number one of this biochemistry test is blood glucose. Blood glucose is the measurement of blood glucose level. If we can know this blood glucose level, it will be very easy for diagnosis and monitoring diabetes mellitus or other conditions related to high blood sugar level. So knowing this blood glucose level, it will act as a biomarker for accurate diagnosis and monitoring of what? Related disease with high sugar level. 2. Lipid profile. This test, lipid profile, it will help us to know the level of cholesterol, triglyceride, and other lipid in the body. So it is an indication for us to know the risk of an individual, of a patient, to a cardiovascular disease, or such as coronary artery disease or myocardial infarctions, what we call heart failure. So the level of cholesterol, triglyceride, it will give us a good indication to this cardiovascular disease. 3. Liver function test, what we refer to as LFTs. LFT help us to evaluate liver health and the functioning of the liver enzymes. And then to do that, we know the measurement or the level of some enzymes that is in blood. Enzymes such as alanine aminotransferase, aspartate aminotransferase, or some of this protein, albumin, bilirubins, and other markers. So As I have called the name of all these markers, it will help us as an indication for diagnosis of what? Liver disease. Liver disease such as hepatitis and liver cirrhosis. Renal function test. Anytime you hear of renal, we are referring to the kidneys. Renal function test. These tests include measuring markers like creatinine, biomarkers like creatinine, blood urea nitrogen, and electrolyte like sodium, potassium. It helps us to assess the kidney functions. So if we can know these biomarkers, it will help us to assess kidney-related disease. It will aid us in the diagnosis and monitoring of conditions like what? Chronic kidney disease and dehydrations. We are proceeding with this course, and I want you to listen attentively. We are continuing with examples of common clinical tests and their diagnostic value. And I've mentioned some already. I continue. Thyroid function test. This test measures level of thyroid hormones. We have heard of a goiter, a condition of the swellings at the neck regions before. Okay? And this hormone we refer to as T3, T4 means there are two of the hormone responsible. And also thyroid stimulating hormones. It's used to evaluate thyroid functions. So that thyroid is located at the neck regions. What is the thyroid functions? So the level of these thyroid hormones, T3 and T4, or thyroid stimulating hormones, the level of it we use as a biomarker as an indication to help us to understand the functions of the thyroid. And they are used in the diagnosis of thyroid disorders, include hypothyroidism and hyperthyroidism. Means whether it's the level of these thyroid hormones, whether it is excess or it is inadequate, it will help us to diagnose this disorder. We are continuing. Cardiac biomarkers. When we talk about cardiac biomarkers such as troponin, creatinine kinase are used to diagnose and monitor heart conditions. The moment we hear cardiac, we refer to heart. To monitor heart conditions, particularly acute myocardial infarctions, heart attack. So, cardiac biomarkers can help us to carry out, to know the level of some of these biomarkers, troponin and creatinine kinase. And so it is an important indication to acute myocardial infarctions, what refers to what? Heart attack. And as we continue, listen carefully. The next one is serum electrolyte. Serum electrolyte is the measurement of what? Electrolyte levels. You know, I told you before that we have, in the cell, we have what we call a extracellular, and we have outside the cell, we have extracellular surrounding the cell, and then within the cell, we have what? Intracellular, in which making organelles attach itself to the cytoplasms in the cell. And so, if now that we mentioned this electrolyte, sodiums are the electrolytes that are in the cell and outside the cell. Potassium also electrolyte in the cell and outside the cell. Chloride are in the cell and outside the cell, but the amount that is present, like sodium, is more abundantly, is more. The percentage is higher at the extracellular than potassium. So this sodium and chloride, they are more abundant in the extracellular than in the cell. But the same electrolyte that is outside the cell, they are still in the inside the cell. But the percentage varies. So it's crucial for assessing fluid balance. Means for the movement of I think you know that water are there is semi-permeable membrane of the cell, and it allows the movement of water, what we refer as what? Osmosis. The movement across semi-permeable membrane of the cell. And so sodium, potassium, and electrolyte, they're also very small. And so they can move across, along with the water across the small peripheral membrane. And so this movement, to have the correct balance, the movement need to be regulated for fluid balance and also kidney functions, acid-base balance. This abnormality can indicate conditions like dehydration, electrolyte imbalance, or kidney disorders. So it is important to note that diagnostic value of this test depends on various factors. The factors that include clinical context, medical histories, whether the family had issue of this related disease, or correlation with other clinical findings, okay, whether there's any other underlying disease. So the interpretation of this laboratory result can be done accurately for the monitoring or diagnosis of a disease conditions. So thank you for giving your listening ears. I know and I do believe that you have benefited a lot. Take your time to watch the video, and then we meet in class as we discuss further. Thank you.